Canadian Fertility Awareness Week starts today. It's an opportunity to join and amplify the conversation to redefine infertility by making it more positive and inclusive. Joining us today to talk about the stigma around infertility and to discuss some of the help that is out there for people is Dr. Christina Pistotnik from Whole Family Health. Good morning.
Good morning.
Thanks so much for joining us this morning. So just how prevalent is infertility among our population right now?
It's actually really common. So 1 in 6 Canadians have struggles with fertility, and the World Health Organization actually released a report earlier this month saying that 1 in 6 people worldwide have infertility struggles. So it's more common now, and it really doesn't discriminate.
Yeah, I wouldn't have thought the numbers were that high, really, because you don't hear a lot of discussion about it. So there's often a stigma of shame and other things associated with it. How is this Fertility Awareness Week going to help out? So we actually this year, Canada redefined Fertility Awareness Week. It used to be known as Infertility Awareness Week. So by doing this, it's making it a little bit more inclusive. At Whole Family Health, we do have patients that don't actually have a fertility diagnosis per se. So they might have recurrent pregnancy loss, wanting to start a family, a single parent by choice, or they're part of the LGBTQ2SIA plus community members. So if we're making it more inclusive of having more positive conversations, it's changing that story around it. We are taught that conception can be quite easy, and really when it isn't for everybody. So like you said, feelings of shame can come about, feelings of isolation. So when we're raising awareness regarding this, we are helping to change the societal expectations. And there's a lot involved in discovering that. If people are planning on having a family, and just to find out all the variables that go into that, it's quite the process to even get that diagnosis, I would imagine.
It really is, because technically, if you're under the age of 35 and you've been trying to conceive for 12 months or around 12 months, then that's when they'll really start looking into things. So, and it can be quite the process, like you said.
Yeah, and for everybody involved.
Yes.
Right? It doesn't matter which partner, and it takes a long time to figure that out. So, and you really believe in whole person fertility care. How is that different from conventional fertility care?
So conventional fertility care it really focuses on the parts, so the reproductive system, the egg, the sperm, the uterus. But that can make things quite procedural and mechanical, can create a little bit more stress on the situation. But when we're looking at the whole person, it really is that. It's looking at other functional systems. We're looking at the mental, emotional well-being of somebody, lifestyle factors. And at Whole Family Health, we really try to incorporate this by giving dietary advice, exercise tips. We have adjunct therapies such as mindfulness meditation, yoga, massage, and acupuncture services. Okay.
When do you start that whole health thing? Is that after there's been a time passed that people are unsuccessful, and then you do this, or is this just, hey, if you're thinking about it, this is how to get going about it?
Really, there's 2 schools. There's some people who have been trying for a while, and they haven't really felt like they've gotten the support that they needed, and then they reach out to us because they see that we offer whole person fertility care. Or some people really do just start off with that way. We'd like people to start off with the whole person fertility care because it is a more supportive way of looking at things. And
a good body, healthy way of looking at things.
Exactly.
Too. And you are a proponent of acupuncture. What difference does acupuncture make? I'm not an expert on acupuncture. I'm not a needle guy.
I know.
So I've sort of been afraid to try it, but where's the benefit in there?
Well, the benefit is it really, so at Whole Family Health, we do use evidence-based protocols. So that means that they've been researched to show that increases blood circulation, helps to balance hormones, regulate inflammation, and increase uterine lining receptivity. It's also been shown to help with assisted reproductive technologies. So things, if people are going through IVF or frozen embryo transfers, it can help to reduce the side effects that the fertility meds can bring about, and can help increase IVF's implantation rates and IVF outcomes.
So obviously, girls carry the bulk of that issue. But what about the boys? Like, is acupuncture in there for them too? And awareness. We have to be aware.
Yes,
right?
yes. Because it takes two, right?
It does take two.
It takes egg and sperm, and
I have a couple to prove that.
So yeah, acupuncture does help with semen health, so it helps to increase motility and the actual numbers of the sperm and sperm quality. So again, it's about bringing circulation to the reproductive organs.
Whole health, whole relationship, kind of stuff as well.
Looking at dietary stuff.
Really quickly, you have a few events coming up for Fertility Awareness Week. What's going on?
Yeah, we're really excited. We are teaming up with Edmonton's newest clinic, Alberta Reproductive Centre, offering their first event is a meetup group at the Kingsman Park under the High Level Bridge. It will be lit up in green in honor of Fertility Awareness Week. And then our second event is a hybrid event. You can either attend online or in person at Park Allen Community Hall. That will be on Sunday.